We are at part three of a three-part series that we began 2 weeks ago, and the overall topic has been what is sequential timeline therapy, and the topic today will be on real-life case management. So just as a recap, part one was the whole history of sequential timeline therapy, and then how we've brought that history forward into our how we use it in our practice today. Part two last week was how to write down your timeline to start your treatment. And as I said, we are at part three today, and that is what it looks like in real life. So just as a refresher from a previous video, the three jurisdictions of Medical Heilkunst are therapeutic regimen, therapeutic medicine, and therapeutic education. And as you'll see in the presentation today, we're going to look at how all three of these jurisdictions apply in the course of someone's sequential timeline therapy. Now, just also as a bit of a recap from a previous video, the whole modality of sequential timeline therapy is, as I wrote down here, it's the specific sequential application of homotonic medicines in reverse chronological order to cure each disease that was engendered in the patient's life force. Now, I know that's quite a mouthful and a lot of terms I have defined in other videos, but essentially what this is saying is the most important concept to take from this is that it's a reverse chronological sequence. So when we have somebody's timeline from their birth event and their childhood vaccines and any of the shocks or traumas that have occurred on their timeline, we start with the most recent, like the ones that have occurred, within even days or weeks or months of the first appointment for the patient. We'll start in the present, and then we work gradually backwards all the way through their timeline. So, as I say in the second point here, we're working all the way back to the birth trauma, and then further into the genetic history that's carried in their family tree. So, what we call the chronic miasms. Or the other way of saying that, it's a form of epigenetic therapy where we're turning off the disease predispositions as they're encoded in the inherited genetics. So again, a quick review from past videos. We have the three jurisdictions, and to give that a little more of a clinical definition, the first jurisdiction of regimen has the goal of balance or homeostasis, and that's where we're using the law of opposite resonance, or the problem to be solved is an imbalance. Of course, we want to bring someone back into a state of proper balance. The second jurisdiction of medicine has the goal or function of palingenesis, and that is on the law of similar resonance, where the problem to be solved is disease. And the third jurisdiction, therapeutic education, has the goal of a healthy mind or illumination. And we call this the law of truth, which is the highest expression of resonance. So the problem to solve here is ignorance, illusion, or belief. So this is just a refresher, but just keep these principles in mind, because I'm going to show you now how these are applied in clinical setting in terms of how we go through the sequential timeline process. So again, fairly briefly, but just to give you a proper orientation and an idea, when we start with the first jurisdiction of regimen and how that applies to sequential therapy, when it comes to going through someone's timeline, treating the shocks and traumas, on the regimen side of the equation, we want to make sure that your innate healing power is properly supported in its general function, as well as any specific needs presented by the timeline clearing in question. Excuse me. And to extend the idea of that point a little bit, it may even be the case, and for some people, if they have some very protracted chronic illness, they have a very weakened immune system, they have a number of health issues, we may even slightly delay the beginning of the sequential therapy and spend more time on the regimen just to build their whole system up, so that when we start into the proper course of the sequential timeline therapy, that they are in a strong enough state to actually go through that process in a productive way. So now, for most patients, normally we start the regimen support at the same time as the sequential therapy. Most people can handle that just fine, but I wanted to throw that in as that more exceptional state where somebody needs to kind of focus on the regimen as a really important precursor before we even get into the sequential therapy. Then the middle jurisdiction of medicine, that's really where we get into the sequential modality, properly speaking. We're giving what we call the homotonic remedies. Normally people call everything a homeopathic medicine, but that's not strictly true. We have what we call homotonic remedies. I did go into more depth of that definition in the previous video, but just if we're splitting hairs here, that's what we would have to say. Now, the distinction I make here within medicine, for most of the typical physical timeline events, say someone's had a broken arm or a whiplash in a car accident, or a medical event such as drug use or surgery or anything like that, usually we are applying the remedies in dry format, like typically what we're doing is on a little a wafer, or sometimes we're using alternative dry forms such as lactose powders or vitamin C powders, depending on people's sensitivities or other restrictions about how they can take medicines. In any case, those are all examples of the dry application of the remedy. And the counterpart to that is what we call the wet remedy, usually the typical dropper bottle, like the brown amber droppers that we use. And on the timeline, when there's something that's not to one specific point in time, but it happened over an extended period of time, and an example of that would be an abusive relationship that went on for many years, while the emotional shock and trauma of that was extended. And likewise, we give the dose of that in the sequential treatment over a more extended period of time, and we're much more easily able to do that in the dropper bottle, because now each drop is kind of gradually peeling away the layers of what was happening, for that extended timeline event, and it's doing it in a more gentle way and in a more kind of gradual and kind of slow but logical sequence over that period of time. And the final jurisdiction is the therapeutic education. And that's where we're kind of going beyond the specific details of the timeline, that we're treating with these homotonic remedies. But we're really looking at the much bigger picture of a person's life, where certain sequences of events or kind of repeated kinds of traumas, repeated patterns in a person's life. And that's where we really have the opportunity to step back and get more of a perspective on what are the bigger life lessons that those individual timeline events are really meant to teach the person. So it's, as I say, we still do use the individual timeline remedies, as I just said, on the therapeutic medicine, but as I say, there's a much bigger picture there. And that's, as I say, kind of the longer, deeper process we go through therapeutically with someone to really grab hold of what the meaning of their life is, what is maybe their purpose and how they've gotten off course. That can often be some of the reason for a trauma that enters into our life. It's kind of trying to give us a message or teach us a lesson. Some people talk about when if they've been in let's say a fender bender or a car accident, you can kind of look at that symbolically as to what is that force that was kind of coming into your life to try to change your course, or to some message like that. So in any ways, when we get into this third jurisdiction of the therapeutic education, it's really kind of taking all the little pieces of someone's timeline and stepping back and trying to see what is the bigger message, or what is the bigger life story that is trying to come out, that the person is really meant to express, but they have been hindered for one reason or another. So then, anyways, this is a brief overview, but these are how the three jurisdictions have a bearing on how we go through sequential therapy. A specific case example, just to make it a little more concrete, I had when we were clearing a timeline event in a woman's history where she had a broken arm. That was quite straightforward. We just gave her the broken arm remedies, the specific timeline remedies that relate to that. But then she came back the next month with something very unexpected, which was that she was having an extended pattern of migraines after we cleared that broken arm. And it didn't make sense at first. Like, it didn't relate to the broken arm. It didn't relate to the next thing on her timeline. So, but what we did by just, further questioning her, we discovered something new that she hadn't shared before, which was for that particular timeline event when she broke her arm, it wasn't just a broken arm. In fact, it had occurred essentially a few moments or minutes after she had received some bad news about her uncle having passed away. So it wasn't just a broken arm as in a physical event, but it was a combination of a physical event and an emotional event that happened simultaneously. So what we needed to do, and we did at this point, we now gave the specific grief remedy, what in this case was Natrum muriaticum, for that whole grief or loss event, and that ultimately finished the job of clearing everything that was happening with that broken arm. So that happened many years ago in my experience, and it really cemented this idea for me that these specific timeline events, we have to be really really specific and really careful to make sure we're getting the full case history of everything that was happening. Even if it was a car accident, how did it happen, and what was possibly the emotional state? Of course, often there are fears, anxiety with an impending car accident if you see it coming, or in this example here, the broken arm that went with a grief event. We normally wouldn't think of a broken arm in those terms, but it was very, very clear in this case. And anyways, that was a big lesson for me as to being really, really specific and clear about what was happening in any given timeline event to make sure we're not missing any of the remedies that will be necessary to clear that out of the person's system. And I guess the main point, I kind of touched on it a moment ago, but when we're doing the sequential therapy, it's not just specific to the middle jurisdiction of therapeutic medicine. It's not just about giving the right remedies to a person, but it really takes into account all three of the jurisdictions. What is that regimental support at the base level to make sure the healing power can do what it's doing? Of course, giving all the correct homeopathic or homotonic medicines as far as clearing the timeline itself. And then, as I also said in the previous slide, what are really the bigger life themes or lessons that we can start to dig more deeply into and really guide a person as to what it is that they're meant to wake up within themselves that's maybe been asleep. Maybe, as I said, some of the timeline events kind of come into our life to try to wake those things up or speak to a bigger theme in our life at another level. And that's where, as I say, we have this whole kind of integrated process where you can't just throw a bunch of timeline remedies at a person and think that's going to do the trick. But as I say, you need to kind of take the whole life, the whole situation into account. And as I say here at the bottom of the slide, just the mechanics of sequential therapy on its own can become very mechanical and ultimately ineffective if you're not taking the full picture into account. So that's the end of the formal presentation. So I will come back and answer any questions. I'll give you, if anyone is watching this, I know there is about a 30-second delay from when I'm talking to when you actually hear it on your end. That's just the way the live streaming works. And in a moment, I will turn off this broadcast. But thank you for joining me today. And again, I will remain here for a few more moments. If you want to type in your question, I can address it now, or otherwise, still go ahead and type in your question, and I will get to it in a future video. Oh, and the one thing I always forget to do, I always forget to come back on camera so you can see my face again and say thank you, and have a good rest of your day, and I will see you in the next video.